Hi everyone, this is Dr. Cascio with Code One Concierge, and I'm going to do a quick little video explaining how you inject testosterone to yourself. So, for those of you who aren't going to get injected at my clinic, you'll go to the pharmacy, whatever your local pharmacy is, and you'll pick up your bottle of testosterone. You'll get these in either 1 ml or 10 ml vials. So what you want to do is you want to figure out, first of all, why do you inject testosterone? And the reason that you inject testosterone, as opposed to other ways of doing it, is that it gets better levels in your blood over time. Now, some places will have you inject once a week, but the bioavailability, in other words, the amount of testosterone in your bloodstream drops after 3 days. So what I and a lot of the more progressive doctors like to do is have you inject twice a week. So what you're going to do is, once you've got it, you're going to need to get a couple things. You're going to need to get alcohol prep pads or little squares here you can buy at any store. And usually, especially if you go to CVS and you pick up a testosterone prescription, they'll ask you, do you want to buy syringes? And the answer is yes, you do. So what you're going to do is you're going to buy, you can buy either on Amazon or through CVS, 1 to 3 ml syringes. And you're going to want to buy either blunt tip fill needles or 18 gauge needles, and that's what you're going to use to drop the testosterone. And then for injection, you'll either use like here, that's pretty big, a 23 gauge, okay? So the gauges go, 18 is huge, 20 is a little bit smaller, 22 is a little smaller than that, and so on and so forth. You don't want to go any smaller than 23 because it'll be very hard to inject. The testosterone is actually in oil, and so it's very hard to actually inject it into your body. So what you're going to do, you need to figure out, the next thing is to figure out, great, that's good. Great. The next thing you want to figure out is, where do I inject, okay? So the typical places that are for injection are going to be in your lateral thighs and the buttocks. Now, it's really important that you understand that you can't just inject anywhere on your thighs, okay? What you want to do is you want to take your hand, place them right like this on your thighs, and anything from the middle finger laterally is okay to inject. You don't want to come immediately or towards the middle, because there's a lot of important blood vessels and nerve areas that you could severely damage yourself with, okay? Your other portion is, if you're going to do it on the buttocks, you'd want to take and go this upper quarter of your buttock. You never want to go down here. You never want to go towards here. You want to be up high in the muscle, because anywhere else, you run the risk of injecting important or damaging important nerves and blood vessels. So how do you inject the testosterone? First of all, you take your syringe here. So for example, we're just going to have this 3 ml syringe. And what you're going to do is you're going to be sterile, okay? So you can buy yourself a pair of gloves, like nitrile gloves from the store, and that's the best way to do it. Once you've identified where you're going to inject, you take your alcohol swab and you swab from the center out, okay? Don't cross yourself, and you're going to let that air dry. That's actually going to sterilize what you're going to be, the skin where you're going to be injected, because you don't want to put fresh bacteria into your wound. So now that you've got your large bore needle, you're going to inject 1 cc or 1 milliliter, okay? And you always pull back a little bit of air before you inject, because it makes it easier for you to draw out, okay? You're going to take your testosterone, you're going to push through, push in the air, and then slowly draw it out. And you want that line to be at 1 millimeter. So you see how you have that little bit of bubble there? You don't want to inject that bubble into your body. So you draw a little out, and then you push it through until you hit the 1. And now you're good, okay? Now you want to put the cap back on the needle. Never, ever, ever take the cap and go this way, because you will stab yourself, okay? So you're going to take it, you're going to lay it down on the surface, and just slide it in, take it away, take this, throw it into your sharps container. You need to buy a sharps container. All right, the next thing you're going to do is you're going to open your package like this. You're not going to touch this part because that's sterile, and you're going to take it and you're going to twist the syringe onto that surface, okay? For demonstration purposes only, we're going to pull it out. And you're going to want it, that needle is about 1 inch, and you don't need anything longer. If you're injecting into your thighs, where you have very low body fat, you can get away with a 5/8 length needle, okay? But anything shorter, it's gonna get into the fat, into the skin, and that's not gonna be as effective. Anything longer, it's gonna hurt, and you run the risk of hurting yourself more. So again, for demonstration purposes, I'll show you that. I'm just gonna cap it, and again, I'm showing you how to cap this needle. Just like that, okay? So, let's say you've identified the lateral thigh, you've marked where you're gonna go, or at least you visualize where you'd go. You've used your alcohol prep pad and you let it air dry. So then what you're gonna do is you're gonna take, I'm not actually gonna stab myself with a fresh needle, folks. What you're gonna do is you're gonna take, and you're gonna inject into your thigh. Now some people, I know it's a little weird, you don't like to do it. I wouldn't jam it hard, but I also wouldn't be tentative. Just push and push it in. And before you inject, always withdraw. You're looking for any blood that draws up into this portion of the needle. If you see red, do not inject the testosterone because you're in a vein. If you see that, just withdraw. Use your alcohol prep pad for a different spot. Usually I go a little bit more laterally. Inject, withdraw, and if you don't see blood up, you slowly inject your testosterone all the way in, okay? Once you're done, pull it out. If you get these kind of needles, safe the needle, put that in your sharps container, or you can just dump the whole thing into the sharps container. And then if you might have a little bit of bleeding, that's okay. Just take a Band-Aid on it, and that's good. One trick we like to use, I like recommend my patients, is either get a foam roller, and you want to roll out this area because it's kind of a viscous solution. You want to kind of spread it out. It's normal to have a little bit of aches and pains for a day or so after the injection. So if you're injecting once a week, you would want to start on, let's say, Monday, and the following Monday, when you go to inject, you would switch sides, okay? If you're doing it twice a week, you just want to switch sides, okay? You want to prevent the risk of scar tissue. So that's it. It's very simple. Make sure you buy yourself a sharps container. You can buy them on Amazon or wherever you like to. Usually small. Keep the sharps away from your kids. Keep your medications away from your children. And if you have any questions, you know where to reach me. Thank you.